what I want to do first is thank you, Pastor Pittman, for allowing me this opportunity to address your congregation. And I enjoyed your message so much. It was just funny that it sort of ties into what I was going to talk about. And basically, we all have a life that we're trying to live as long and as healthy and as much quality as possible. But there are two factors that I wanted to talk about today. One factor is circumstance. A lot of it has to do with the grace of God and favor. There are a lot of things that can happen to us that we have no control over. But there's a small percentage that we can control. And that's what I want to talk about today in regard to our health. So basically, what started this entire ministry was over like 25 years ago. I was in residency out in Los Angeles, and I flew to Mississippi to visit my grandfather on his deathbed. He was diagnosed with metastatic prostate cancer. That means that he had cancer that started as one cell, and he wasn't getting his screenings like he was supposed to, because he was a superintendent with the Church of God in Christ. And his teachings, he later told me that they were wrong. He said, don't worry about the doctor, don't worry about all these lab tests, just believe in God. And God is going to save you regardless. But when I talked to him in our last conversation, when he was on his deathbed, when he was told that the cancer had spread all over his body, to include his colon and other parts of his body, there was nothing that could be done. But he also understood that had he have gone in and got screened on a regular basis as he was advised, it could have been diagnosed early. It could have been treated. And he could have still been with us. A warrior in the kingdom of God in Christ, and still helping people with their spiritual journey. But he said, Tim, he said, I'm not like you, Pastor. He said, Tim, he said, we never would have thought you would have been a doctor. I literally made a 13 on the ACT. I used to be the fun guy. I'm still the fun guy. But he said, God called on you to be a doctor because he said you can relate to people that might not go to the doctor. Like, you know, God uses people that, like you said, that have qualities that can attract other people. But my grandfather told me that God wanted to use me because I could attract people to pay attention to their health, because I could just communicate on their level. But at the end of the day, I want to encourage everybody to just understand that you do have an impact on your health. Get your screenings, get your mammograms if you're a lady, get your colonoscopies, and a lot of these cancers can be diagnosed early and treated. And I'll tell you somebody that can be a witness today, me. About 2 years ago, I started having some numbness in my my upper and lower left extremity. And my wife said, let's go get it checked out. And I said, I don't need to go to the doctor. I'm a doctor. But I went to see my doctor. They referred me to a neurologist. And they told me that they wanted to do a CT of my head. So I followed directions and got the CT. And there was a mass on my brain. But God was with me. That 80%, that high percentage that you have no control over, the mass was diagnosed so early, it was right on the tip. And they just cut into my head, and that's why I had a hair, because that surgical scar, you know, I didn't really like it, but it's cool. But anyway, so they were able to remove the tissue that had the cancer before it had an opportunity to spread, like my grandfather. And I see that as an opportunity to encourage my patients and those that might not be my patient, because everybody has the opportunity to, fight back these things that we cannot control, but we can gain favor from God, following Pastor Pittman's wise words. And I just want to tell about a story that is so encouraging. Everybody out there needs to really be engaged in your physical health, because when I had my cancer, it affected my nerves, and I had to rebuild all those muscles. But my surgeon told me, because I was in such good physical shape, see, I run in my neighborhood, and my surgeon lives in my neighborhood, but he's a neurosurgeon. His house is so big, I could probably put our house in his living room. But anyway, long story short, his wife, she's always looking out the window, and she says, there goes that man. It might be 100 degrees, or it might be 5 degrees. I'm out there running, like I've been running the whole time. When I was younger, they used to call me Forrest Gump. Because I went to med school in Nashville, and, I was from the South, and I would run all the time, and I never stopped. But you don't have to run. You can walk. Just do whatever you can. Like, when I first had the tumor removed, I couldn't run it anymore. So I went to physical therapy, and they had me swimming, and I still swim. I swim laps now, and they had me riding a bike. So I started using my wife's Peloton bike, and she transferred over to the treadmill because I've taken over the bike. But I just wanted to end by telling a story about my daughter that is just so impressive to me. So my daughter wanted to be a cheerleader, and like maybe 2 months before the trials, she learned that all the other girls were getting private lessons. Because, sometimes when we go to these majority schools, we might not be up on everything that everybody else knows. And those lessons were expensive as heck. But the funny part was, I was getting ready to get a new car that I really, really wanted. So when I found out how much the lessons were, I called the car salesman before I signed the paperwork and told him I had to wait 1 more year. So I redirected the money that I was going to be paying towards the car to those lessons, and we would go twice a week for 2 months. And basically, my ex-wife and I, we didn't make it. So I would go visit my daughter frequently, like 2 or 3 times a week. And I went there the night that she received the email of the results. And the email read, regretfully, we inform you did not make it. So I said, let's go for a ride. Let's go for a ride. She was crying, and I was feeling really bad. And we were driving. And she said, what time are you going to pick me up tomorrow? And I'm about to start crying. She said, what time are you going to pick me up tomorrow? I said, why? I said, you didn't make it. She said, I have to go to practice tomorrow, Dad, because I'm going to make it next year. I called that salesman. I told him, I said, sir, I said, I'm not going to be getting a new car for at least a year. He was so disappointed because it was a big sale for him. It was a nice car. But I continued to pay for those lessons twice a week. I pretended like it was my car note so it didn't hurt so bad. But a year later, I went back to that same car lot, got the car, and my first trip was to go cheer for my daughter, the cheerleader, as she cheered for the St. Andrew Saints. But that's what you were talking about, Pastor. You were talking about you have to have determination. You have to have grit. And if you are trying to do something, don't let anything stop you. Even if you fall short, you might get cancer, you might not be able to walk, you can swim or you can bike, just do something. I have a lot of patients that are seniors, and they do something called chair aerobics where, they're getting some kind of exercise. But the main thing I want to leave you all with is make sure if you have a physician, follow up with your physician as recommended. And if the physician says, you need to get screened for anything like cancer, get the screening. And I have one drop of good news for the men that are looking at me. You don't have to get that test anymore. You can do it through the blood. And for colorectal screening, there's a new test called the Shield test where they can just draw blood and you don't have to get the colonoscopy. Technology is amazing. And that's why I know that there's a God. Because there's no way that man can come up with a way you can look at somebody's blood and tell if they have colon cancer or if they have prostate cancer. But for the women, still got to go do the mammogram. But a lot of the women say the mammogram is so painful. But I've had patients, I've been a doctor for 23 years, Pastor, and I've had patients that go for, chemo, radiotherapy, and they have breast cancer that's metastasized. It's too late. They didn't get the mammogram because they were afraid of the pain. I remember one patient, her cancer had spread to her bones, and she was in excruciating pain. She had to take narcotics around the clock. So how many women have had a mammogram? How long is the pain? 10 seconds? But just imagine 10 seconds to a lifetime that's cut short. And it doesn't have to be cut short. And if your doctor prescribes you blood pressure medicine, take the medicine every day. I have so many patients, I was in Kroger the other day on Mother's Day buying flowers for my beautiful mom that came out to support me. And I saw a patient and he said, "Hey, Dr. Quinn, I don't take the blood pressure medicine no more." I said, "Why?" He said, "Because I've been exercising." That's not the way to do it. But I've had a lot of patients that have embraced their physical fitness, and over time, we tapered them off the blood pressure medicine. But it's got to be a coordination between you and the doctor. But at the end of the day, I feel like God has blessed me with a message and a ministry where we can get people knowledgeable about the percentage of their life that they can control. And, technology has come so far. And I just hope that what I'm leaving with you all will make an impression. So if you haven't been to your doctor in the last year, go visit your doctor. And if you're on blood pressure medicine and you're not taking it, take it. And if you don't exercise, start exercising, because you're showing God that you want to be in a more advantageous physical condition. And if God sees you take one step, He's going to give you 3 steps of progress. And I'm looking at Miss Upkins. She's very serious about her walk, and she walks every day. And I'm not supposed to tell your medical business, but I'm telling you, this woman was knocking at the door for diabetes. And you know what she said? "No, thank you." And she beat it. Stand up, Miss Upkins. Doesn't she look good, y'all? She's lost a lot of weight. She's a supermodel now. But listen, I'm going to close because I'm out of my time, and I'm very respectful. But what I was doing this morning is I have to take these tests to stay board certified, and it comes around every 10 years. And I had to take so many, but I took some this morning, and I was going to try to take as many as I could, but I'll take the rest this evening. So I just stopped and I said, let me go hear this message by Pastor Patterson. And I'm glad I came because it was a great message. But everybody prayed that I can knock out the rest of these tests this afternoon and pass and stay board certified. Thank you very much.